sometimes the gland doesn't do a good job, or it makes too little hormone, which is called hypothyroidism. Sometimes it makes too much, which is hyperthyroidism. Kind of the most common out of everything is the hypo or the low thyroid hormone level. You can either be born with it, or you can kind of acquire it over your lifetime. In babies, now all newborn babies are screened for thyroid, low thyroid, with the newborn screening, that is the state-run program. And thankfully, with that, we are able to identify kids who may have low thyroid hormone much earlier than we would have otherwise. With low thyroid hormone, like I said, think of it as fuel for the cells. If you're not making enough, you can have low energy. You may not have a lot of appetite, but you tend to gain more weight. You can, feel very cold, and in situations where other people are not. Your bowels don't move so well, so you can have constipation, dry skin, hair loss, kind of very non-specific symptoms. And in kids, the other thing is growth in terms of height. So that's something we watch very closely. If you're suspecting a thyroid problem in a child, they may gain weight, which is pretty common, but they also don't grow that well in terms of height. So if you make too much hormone, it can kind of have the opposite effect. So you feel kind of agitated, increased energy, you may sweat a lot, feel very hot when others are not. You may have trouble sleeping. Kids may have trouble concentrating in class and focusing on schoolwork. Diarrhea, or just having to use the bathroom more often. So these are all some of the symptoms of the high thyroid hormone level. If you're not making enough hormone, you basically replace what's missing. So we have the synthetic form of thyroid hormone. The generic name for that is levothyroxine. There's also other brand names. People would have heard of Synthroid. It all is the same thing. So you basically replace what's missing. And side effects are pretty negligible, because you're just kind of replacing what's missing, right? The other way around, if you have too much hormone, there's medications we can use to decrease how much hormone is coming from the gland. And the medications may not work forever, so in some cases we would have to go in and get surgery to remove the gland, or use radioactive iodine, which can kind of ablate and destroy the gland. And we have 2 pediatric endocrinologists, 1 nurse practitioner, and we work closely with families who have thyroid disease and other endocrine disorders. Thyroid disease is one of the most common things we see in endocrinology, so most of us are very adept and comfortable with managing it. We have the lab here that runs all the assays needed to check these hormone levels. We have radiology when we can do the ultrasound. Everything can be done in the same place. If a situation comes where the child needs thyroid surgery or ablation, we have a team that could help with that as well. It's very satisfying to know that you can really make a difference in the lives of children in the community. There's not a lot of pediatric endocrinologists in West Virginia, so in this part of the state, there's very few. We do see a lot of children from West Virginia, as well as some of the surrounding states, who come here for their care.